HIPEC, or hyperthermic intraperitoneal chemotherapy. It sounds futuristic and complicated, but it's actually just a remarkable, proven technique that has dramatically improved outcomes for patients with peritoneal mesothelioma. If you're being evaluated for cytoreductive surgery, HIPEC is almost always part of the procedure. Today, I want to explain exactly what HIPEC is, how the heated chemotherapy actually works, why heat makes chemotherapy more effective, what happens during the HIPEC portion of the surgery, and what research shows about its effectiveness. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician and this is not medical advice, but understanding HIPEC helps you know what to expect if you pursue cytoreductive surgery. So let's start with what HIPEC actually means. Hyperthermic means heated. The chemotherapy solution that's used in the procedure is heated to about 41 to 43 degrees Celsius, which is about 106 to 108 degrees Fahrenheit. That's warmer than the normal body temperature of 98.6 Fahrenheit, but not hot enough to cook tissue. Intraperitoneal means inside the peritoneal cavity. It's the space within the abdomen containing the intestines and other abdominal organs. The chemotherapy is applied directly into the peritoneal cavity onto its surfaces rather than being given systemically through an IV into the bloodstream the way that traditional chemotherapy is administered. Chemotherapy refers to cancer-killing drugs. For peritoneal mesothelioma, cisplatin is the most commonly used drug for HIPEC, though some centers use mitomycin C or other agents. So HIPEC delivers heated chemotherapy directly into the abdomen during surgery to kill microscopic cancer cells that remain after visible tumors are removed. Here's how HIPEC fits into the overall operation. First, the surgeon performs cytoreductive surgery, systematically removing all visible tumors from the peritoneal cavity. This might take 6 to 10 hours, depending on the extent of the disease. The surgeon removes tissue from various regions, removes involved organs like the spleen or parts of the intestine, and cleans out all visible disease. Once this is complete and all visible tumor materials removed, that's when HIPEC begins. Catheters, which are inflow and outflow tubes, are placed into the abdomen. Sometimes the abdomen is temporarily closed, or sometimes a specialized approach called the Coliseum technique is used, which suspends the edges of the abdominal incision upward to create a basin. Now, there's a lot to go over here. Before I get further into this treatment, I'm going to take a break and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. And if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, back to the HIPEC part of the procedure. The heated chemotherapy solution, there's typically 3 to 6 liters of fluid containing the chemotherapy drug that gets circulated through the abdomen. The solution enters through the inflow catheters, bathes all the peritoneal surfaces, and then exits through outflow catheters to a pump circuit. The pump circuit heats the solution to the target temperature, as I said, usually 41 to 43 degrees Celsius, and then recirculates it back into the abdomen. This means there's a continuous flow of heated chemotherapy washing over all the peritoneal surfaces. During HIPEC, the surgeon or surgical team will actually manually move the intestines and organs to ensure that the heated solution reaches all the surfaces. This manual agitation prevents pooling and ensures even distribution. The procedure continues for 60 to 120 minutes, depending on the protocol. Most commonly, it's right in the middle at 90 minutes. Throughout the entire process, the heated chemotherapy continuously bathes the peritoneal surfaces. Monitors track the inflow and outflow temperatures to ensure that the solution stays at the target temperature. If it's too cold, the effectiveness decreases, and if it's too hot, it risks tissue damage. So temperature probes are generally placed at multiple sites in the abdomen to ensure even heating. So after that 1 to 2 hour period, the chemotherapy solution is completely drained from the abdomen. And then the abdomen is irrigated with saline to wash out any remaining chemotherapy. And then the surgeon completes the operation. They reestablish any intestinal connections that were broken or separated. They check for bleeding and they close the incision. Why does heating the chemotherapy help? Heat itself has anti-cancer effects. Temperatures of 41 to 43 degrees Celsius are directly cytotoxic to cancer cells, meaning they kill cancer cells or make them more vulnerable to chemotherapy. Heat also increases the penetration of chemotherapy into tissue. The heated solution penetrates 3 to 5 millimeters into tissue, which means they potentially reach microscopic cancer cells that have invaded slightly below the surface. Heat also increases chemotherapy drug activity. Many chemotherapy drugs work better at higher temperatures. Their cell-killing effect is just enhanced. Why deliver chemotherapy directly into the abdomen rather than through an IV? Direct delivery achieves much higher concentrations at the tumor site, sometimes 10 to 100 times higher than could be achieved with IV chemotherapy, and it eliminates the systemic administration that's so often associated with side effects. The peritoneal surface is where residual microscopic disease remains after cytoreduction. So targeting this area with a concentrated solution makes biological sense. The combination of complete cytoreduction plus HIPEC addresses peritoneal mesothelioma at 2 levels. Cytoreduction removes the macroscopic disease, meaning tumor nodules that are visible to the eye, and HIPEC targets microscopic disease, the cancer cells that are invisible to the eye that remain on the peritoneal surfaces. This 2-pronged approach is why outcomes are so much better than either cytoreduction alone or chemotherapy alone. What chemotherapy drugs are used for HIPEC? Cisplatin is most commonly used for mesothelioma. Doses range from 75 to 250 milligrams per square meter of body surface area, and that depends on the physician and the facility's protocols. Higher doses might be more effective, but they also carry the risk of greater toxicity. Mitomycin C is used at some centers either alone or in combination with cisplatin. Other drugs are used less commonly or are currently only offered in research protocols. The choice of drug and dose is going to vary between centers based on their experience and protocols. You may have heard of NIPEC, NIPEC. Some centers also give that. It's called normothermic intraperitoneal chemotherapy, and it's chemotherapy at regular body temperature rather than heated during the early post-operative period. It might be given on post-operative days 1 through 5 through catheters that were left in place. It extends the peritoneal chemotherapy exposure beyond the intraoperative HIPEC. And, the evidence for added benefit is mixed at this point. Not all centers are using NIPEC. What are the side effects and risks specific to HIPEC? The heated chemotherapy causes some additional toxicity beyond the surgery alone. Cisplatin can cause kidney damage, so aggressive IV hydration is given during and after surgery to protect the kidneys. Bone marrow suppression can occur, affecting blood cell production. Electrolyte abnormalities, particularly low magnesium and potassium, are common with cisplatin. The heating itself can cause tissue inflammation and could contribute to postoperative complications like a temporary paralysis of the intestines or anastomotic leaks if intestinal connections don't heal properly. However, these risks, they need to be balanced against the substantial benefit that HIPEC provides when combined with complete cytoreduction. What evidence supports HIPEC for peritoneal mesothelioma? Multiple studies from experienced centers show excellent outcomes with cytoreductive surgery plus HIPEC. 5-year survival rates of 50 to 75% are reported at high-volume centers, which is dramatically better than historical outcomes with chemotherapy alone. No randomized trials have specifically compared cytoreduction with versus without HIPEC for mesothelioma, so we can't definitively prove HIPEC's contribution versus cytoreduction alone. But the consistently excellent outcomes from centers using this combination and the biological rationale for HIPEC's benefits support its use. HIPEC has proven value for other peritoneal cancers too, including appendix cancer and ovarian cancer, providing additional validation of the technique. What questions should you ask about HIPEC? What chemotherapy drug and dose will be used? What temperature and duration? Do you also use NIPEC or just intraoperative HIPEC? What monitoring is done during HIPEC to ensure safety? What are your complication rates specific to the HIPEC portion? How do your outcomes compare to published data from other centers? To review, HIPEC delivers heated chemotherapy directly into the abdomen for 1 to 2 hours during cytoreductive surgery. After removing visible tumors, a heated chemotherapy solution is circulated through the peritoneal cavity and manually distributed by the surgical team. The heat enhances the chemotherapy's effectiveness, increases tissue penetration, and directly kills cancer cells. The high local chemotherapy concentrations target microscopic residual disease on peritoneal surfaces, and in combination with complete cytoreduction, achieve a 50 to 75% 5-year survival when performed at experienced centers. The main drug used is cisplatin, and there are possible side effects including kidney stress and bone marrow suppression. Visit mesothelioma.net for more information about HIPEC and where these peritoneal mesothelioma treatments are performed. Or call us at 1-800-692-8608 or use the live chat feature to speak to one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.